yes, when we are assessing NFTs, you're going to get other muscles contracting, but they're going to contract less than the muscle that you are trying to assess, because you're putting that muscle that you're trying to assess in a position and using a force that is in a direction that is unique to that muscle. And that muscles do more than one thing, which I hope you understand, but it's mind-blowing how many people comment on social media posts and they think that your vastus medialis and your vastus lateralis are knee extensors, and that's it, because that's all they do is pass the knee. So I want to do this little quick exercise with you. So if you want to play along at home, grab your netter or whatever anatomical book you used or you're using in PT school or chiropractic college, whatever it is. Grab that, or grab any anatomical chart. This is information that I'm talking about that's out there, that's been out there for hundreds of years that people seem not to understand. So I just want to make sure we're on the same page. So if we take a look at netter, so here are your quads. Now, notice that your vastus medialis has a different pennation angle than your vastus lateralis, which is different than the way your rectus fem runs, and how unique that is. Also, if that's not clear enough, let's take a look at your adductor magnus. So adductor magnus, the wording would think that the adductor magnus is going to do nothing but adduct your thigh to your midline. Well, here's adductor magnus, and wow, look at how that pennation is at an angle. Wouldn't that mean that that's got a transverse plane responsibility in its function? And if we look at quads again, do you think that as the angle of the knee joint changes, the onus on the muscle belly contraction might also change? And do you think if the rotation component at the hip changed, that the alignment of this pennation would change, changing that in this instance, let's look at the vastus lateralis. So as the hip angle changes in regards to rotation, do we think that would put a different responsibility or a different action on that muscle due to its pennation and its origin and insertion? Now, according to some experts on social media, your quads do nothing but extend the knee. So your vastus medialis and your vastus lateralis and your vastus intermedius, the only thing they do is extend your knee, and the only thing they do to extend your knee is at 90 degrees of flexion. So knee extension at 90 degrees of flexion. So why do we have all of this pennation? Why do we have different heads of these muscles? Why are they so long? And why do we have multiple muscles? If your quads only extended your knee, wouldn't you need just one quad that sat right there and did nothing until you were at 90 degrees of knee extension? That would make sense for manual muscle test. So that would make sense to only test quads in one position of 90 degrees of knee flexion doing knee extension. This says that thought process makes no sense. So this is why we are putting people in different positions of rotation, flexion, abduction, internal rotation, external rotation, all that stuff. So when we look at our manual, and I'm just going to randomly pick a muscle here, whatever pops up. So tib anterior. So tib anterior. Here is our test for tib anterior. Okay. So see how tib anterior doesn't run in a straight line. So it's not a single plane muscle. You will be hard pressed to find a single plane muscle in your body. Your body functions with transverse plane components. If your patients cannot handle transverse plane, can't function in the transverse plane, that's why they have pain. That's why they have injury, because pretty much every muscle in your body has a transverse plane component. So if we look at your levator scapula, that's traveling in a transverse plane. If we look at your gastroc, holy cow, look at that. That's not a single plane muscle. That's got two different planes. Wow, we might, if we wanted to assess neuromuscular function of that muscle, we might have to put it in two different positions. So that's the thought process that went into developing neuromuscular facilitation tests. The understanding that your body, your muscles, travel in transverse planes. In this picture, there is no muscle there that only travels in a single plane, and the only one that's even close is rectus fem, which is why we position it in the position that we position it in when we are doing NFTs. So notice these all have transverse plane components. Okay? So if all of your quads only did knee extension and only in a single plane, you would move like a robot. Same thing with all of this other stuff. So that's why when we put muscles in different positions, we are testing different heads of different muscles. So when we change the position, we change the angle of the rotation, we change the angle of the flexion, extension, abduction, whatever. We're changing the plane that we're pushing them in. We are changing what we're testing as far as facilitation goes. So that's why it takes 2.5 days to learn all 130, 135 tests, whatever it is, in that manual that I just showed you. So then you understand when you are looking at human movement in a functional screen, you are seeing gross movement. You are not seeing individual muscles working. I've been